We are in verbal communications with Kaiser and are confident that we will be able to work out a similar type of agreement.
So if you take those three, what percentage do they represent of the Knox-Keene plans in California?
Probably over 90% of enrollees.
Over 90%.
I mean, Kaiser alone has 6.6 million enrollees.
Okay. So this is a very interesting development. And again, appreciate you coming forward and using this forum to announce this. I like to think, well, I credit the advocates and department for pressing, but we're going to want to listen very carefully to, obviously, to the insurance commissioner, the consumer watchdogs, but most importantly to the advocates out here who, the only thing that matters in the end is whether this makes it easy for parents in an otherwise difficult situation to be able to get the help they need. That's the test, right? That is the test.
That's our goal.
Okay. Mr. Flanagan? You walked out the door. Well, that's all right. If we can just make a seat for Mr. Flanagan, that would be good. You're all welcome to stay because other committee members, I'm sure. Mr. Flanagan, from Consumer Watchdog, been intimately involved in this by virtue of filing a lawsuit attacking the DMHC previous 2009 underground regulation. I want you to be brief, okay? But if you can just give us sort of the 30,000 on what if you've reviewed the settlement, just some things we ought to watch for. I'd be tentative in your. I don't think we're at a point where even you maybe want to state final conclusions here about it, but maybe you do.
I did have the opportunity to review it last night and this morning. 2 points. One, existing law does mandate ABA coverage, and I was a little concerned in the beginning about there's a question about that. I think that the insurance commissioner deserves a lot of congratulations for standing up here to say that.
Well, absolutely. And he does, because he's always taking the bull by the horns. But we believe the same thing, at least a lot of us. That's why we're pushing the bill. But the fact that we're here, it is the law, but it's not being interpreted as the law. So any advance we can make, whether it's through settlement, whether it's through legislation, whether it's through the strong advocacy and action of the regulator, is all good.
I agree.
We're not in a place where we want to be now.
So to be clear, we don't necessarily have to wait for new legislation, but really push the DMHC to enforce the law.
So what's your?
So I have 5 points as well. One, under the settlement, the DMHC still says that license is required in order for a provider to provide APA. That's the statement up front. Blue Shield.
We'll get back to you.
Blue Shield also, this is in the findings, states that ABA is not a medical procedure. Number 3, there's a supervisory model on paper. So what the settlement says, though, the DMHC still believes that licensure is required for ABA to be covered. For purposes of the settlement, we're going to require Blue Shield to cover ABA under the supervisory model where there's a licensed provider. A couple problems with the way that system is set up. One, there is no provision in there that a BCBA or someone that has a ABA certification from a national organization actually knows how to perform these services can be the supervisor. And those are the folks that really understand how ABA must be provided. But most importantly, the essential problem here is that there is nothing in the settlement that requires Blue Shield to have an adequate network of providers. The findings, and this is the essence of it, the findings state the DMHC believes it's necessary that Blue Shield and other providers have an adequate network of medical professionals. But the meat of the settlement, the requirement on the insurer, does not strictly require an effective network of providers. And this is the problem currently. People are waiting a long time for Blue Shield.
There needs to be providers for it to work. I'm going to have Ms. McKinnon and her team respond.
And what the report says is that Blue Shield will, quote, assist parents, and if parents can find a licensed provider, Blue Shield will pay. But if the parent cannot find a licensed provider, Blue Shield is off the hook.
I'm glad you're putting it out there on the record. We're going to hear a response in it at number 4.
Number 4, that was maybe number 4.
Okay, then,
but number 5, if Blue Shield asserts there is a change in the law, either through litigation or otherwise, they can opt out of the settlement and pursue other negotiations with the department. So this settlement can terminate if Blue Shield can cite some quote change in the law. Then these negotiations will have to start all over again. This settlement should be binding and have a clear requirement on the plans. I'm
not carrying a bill to deny people ABA coverage.
No, I understand that. No,
I'm just saying, what change in the law are you? What change?
That's a good question. I'm not. It's necessarily not this legislation. It could be litigation. It's unclear what they're saying. Good
point. Okay. Are those the 5?
For that report, I would also, there's one other issue. The issue of existing law requiring a mandate has been very clear. Court of Appeals in California have found that to be the case. The DMHC, I believe, with this report is really trying to deflect attention today by attempting to say that we're handling a problem they haven't handled, and I certainly hope that the committee keeps its scrutiny on the department and
of course
keeps that follow-up.
That's why we're not throwing bouquets out here, We're recognizing this is a potential advance. This needs to be reviewed. It needs to be reviewed thoroughly by the commissioner, by you, most importantly by the advocates, and then we'll come to a conclusion. But again, the only thing that matters, the law is the law is the law. Are parents and kids getting the help that they need? That's what we want to know. And if this helps, then it helps. It may not be the end, but it may help. So let's go through all 5 because I think these are important. Is licensing required?
Okay.
What about Blue Cross saying that it's not a medical procedure? What impact does that have on the actual provision? Is there an adequate network, or is it all on the parents to find somebody? What about this opt-out provision? Okay.
So the first provision in the recitals, basically what we are doing is we are setting forth our disputes. We know that our department does not agree with the health plans. The health plans do not agree with us. In order to do the settlement, that's what the recitals are. So that's all they are. And that's just to preserve our rights for the litigation that the department is involved in, as well as the health plans. That's all it is.
Nobody admits fault, in other words.
Correct.
You just go ahead and as a recovering lawyer, I remember those provisions. Yes.
Yes. So that's all those provisions are. The third one, I think he had asked about the licensed provider. We acknowledge that the consumers and the advocates have indicated that ABA is not usually rendered by licensed providers. The department's position in its litigation is that licensure is required under the Knox-Keene Act, and it's a good idea for safety purposes. That said, in order for these kids to get services, the plans have agreed that they'll either use a licensed provider or they'll have a supervising licensed provider, and those supervising licensed providers may oversee either the BCBAs, which there's probably not enough of them either, or other providers that have experience, that have ABA training and experience in serving children with ASD, with autism spectrum disorder. And that's why we wanted to make the settlement agreement broad enough, because we heard the consumer advocates and their concerns that there weren't enough providers out there and that they wanted this to be a little broader. And so the plans have agreed to do that, or Blue Shield in this written agreement, and hopefully in the subsequent other written agreements, will have a broader network. So that's where we are in the licensed provider.
I'm going to want to hear, not necessarily today, but Ms. Martin and Ms. Jacobson and others about, again, what that means for the real family in the real community in California getting the service they need.
Mm-hmm.
Okay? Yep. What about the opt-out?
Opt out, I mean, obviously any settlement agreement, if their law changes, you're going to have to follow whatever the current law is. Basically what the opt out agreement is first of all, it has to be a final decision. So again, we're involved in litigation. Some of this litigation could take several years. What it requires is that if Blue Shield or a health plan feels that there is a final court decision or some sort of legislation that supports their position that ABA is not a health care service that's required to be covered under the Act, or if Blue Shield says that they may lawfully deny coverage because you're not using a licensed provider, they have to give the department 60 days notice, and then they can suspend it, and then we will meet. The agreement requires them to come and meet and confer with the department to try to reach a further settlement. But what we really wanted to do, Senator, is we understand this debate. It has gone on and could go on for several more years, and we wanted to do something now.
I'll tell you what, maybe one of the things to do here, Mr. Vismara, Mr. Vice Chair, Senator Leno, is maybe we schedule another hearing in several weeks. The specific No.
Well, what I would suggest, Senator,
specifically to review the settlement and actually flesh out, some of these issues.
Well, the one thing
sensitive,
it's sensible, but probably premature.
I said sensitive.
Oh, okay. Well, that is sensitive too.
But I appreciate you saying it's sensible.
But what I would think would help would be that if we give it a little bit of time, because we already talked about the liaison at the Help Center that's going to be working with the consumer groups to make sure the settlement. But what we want to do is make sure it actually works, where we're not getting the numbers of ABA denials in the Help Center. So probably would take longer than a couple weeks. If we did it, 3 to 4 months out, we could bring you statistics and hopefully show you that we have had a dramatic drop in the number of complaints that we're getting in.
Yeah.
So
fair. I mean, we'll think about it.
Okay.
Let's talk. We'll think about it. Mr. Commissioner?
The Department of Insurance has asked, and DMHC has responded in the affirmative, that our senior staff have an opportunity to meet with theirs before they execute another settlement agreement. And so we would like the opportunity. I appreciate DMHC's testimony with regard to road testing the Blue Shield settlement agreement, but we've respectfully asked, and I believe DMHC has responded in the affirmative, that our two departments have an opportunity to meet at a senior level to discuss the issues that have been raised and potentially competing views, to see if there might be some resolution related thereto before another settlement agreement is entered into. That certainly is that is a call for the Department of Managed Health Care. It's up to them. Our understanding is that they're amenable to having that meeting. We'd appreciate the chance to do so, to see if before another one is entered into, we can resolve any disagreements. And there may not be resolution, but our desire is to see if there might be an opportunity to resolve disagreements that currently exist, potentially vis-a-vis the department's different views.
Sooner than later, please.
We're making ourselves. We've communicated. Once we saw the settlement agreement yesterday, we immediately communicated our desire to sit down, and our understanding is the department is willing to do that.
Absolutely.
It is, not that we're dealing with government organization here, but it is odd that California has a system where, with two different, parallel regulators dealing with the same topic. And so I think it is important that the department communicate with the elected commissioner on all these steps and try to come together where you can.
We've had a very good collaborative working relationship with the department.
Okay. Good. Well, I want to thank everybody for coming. And this is very, very informative, instructive, and I think, in fact, I'm confident to say that progress is being made. The question remains how much progress, but we thank you all for taking the lead, both the commissioner and the department, in trying to help families here. Mr. DeVent, did you have one last comment? No. Okay. Good. Thank you very much.
Thank you very
Appreciate it.
much.
Thank you, Commissioner Jones, especially.
Senator, thank you for your leadership. You were far too modest a moment ago in describing where the credit lies for the progress that has been made to date, and it lies with you and your colleagues on this committee who held an incredibly important hearing a year ago and have held this hearing. And I know both departments want to thank you for your tremendous leadership and your responsiveness to all of the concerns associated with this issue. Thank you very much, Senator.
Thank you, guys. Thank you. We do have now time on the agenda for public comment, and it's an important part of the hearing. I don't think that we cannot hold a lengthy discourse right now on what we just heard. Yeah, do we have a show of hands of who wants to testify publicly? Okay, come on up. I'm going to ask you to be brief. And again, there's going to have to be some exhaustive review and probably public hearing on what we just heard regarding the DMHC settlements. I don't want to litigate that. Don't want to litigate that here.
Members, this is impressive. I'm glad to be here. My name is Connie Lapin. You said you want to hear from advocates. Well, I'm an old one. And I'm here because of my son, but also because of what he went through. My son's 43, and I probably think I have the oldest kid here. I'm here because I don't want what happened to him to happen to the other ones. And I'm here also to thank you guys, because when he was around, there weren't legislators that were interested and that were willing to make a difference. If you would time travel with me, you would find out that my son was a victim of his times because there was no interventions. And it's a tragedy because he is severely impacted and he's severely expensive. I don't know if we use that word. What do we know?
What you mean.
Yes, I know. What do we know? And I will be brief. We still don't know what causes autism. I mean, that was apparent from the testimony. We don't really know that there's a definite cure. If you meet one, and I'm sure you've heard this, you meet one person with autism, you've met one person. They're all very unique. Although autism is not a disease, the medical issues create neurological conditions that are profound, and I don't need to tell you what they are. You know what they are. What's the good news? There's neuroplasticity of the brains. And what's amazing here, no one, even with the controversy or the conflict, no one said early intervention is bad. We all know it's good and it's necessary. We do know that, and this is just another thing I want to add, that there is a variety of evidence-based treatment, and they must be dynamic, developmental, and evolutionary. We don't know what causes autism, so we need to be open to that. And I want to use other words like PRT, DIR, RDI. I mean, it's not only ABA. Finally, I've coined a term, developmental disabilities. It's called DD. Well, I call it denial by delay, and I think we see it here. We see this. And as parents and concerned about our kids, what are we supposed to do with that information? There was an Emmy 37 years ago called The Minority of One, and I don't know if anyone's old enough to remember Lloyd Nolan, the actor. He came out and said, I have a son with autism. And at the end of the Emmy, the movie, the documentary, he said, you know what, and this is the bottom line here, our kids are going to grow up one way or another, trained or not. So in this House of Laws, thankfully to you, Senator Steinberg and Assemblyman Bell, we want this piece of legislation passed. We need it. I don't want to be here next year, and I know you don't want to be here next year, so thank you.
Thank you, Connie. Appreciate it. Always very much. Let's go through again, if we can, relatively briefly, because we're running over.
Good afternoon, Assemblyman Senator Steinberg and members.
Used to be an assemblyman. It's okay.
My name is Lisa Cooley. I represent the California State Council on Developmental Disabilities, like Ms. Lapin a minute ago. I am here because I am able to be with you this afternoon because I have adequate medical coverage that covers my disability, which is cerebral palsy. I want the same thing for future future generations of children that have autism and other related disorders on the spectrum. Thank you.
Thank you very much.
Hello, my name is Fatal Maliti. I have a 6.5-year-old son named Mohammed with autism. I want to just bring up one specific point because I know everybody's going to go through the line here. But part of the settlement agreement is it says that they were going to pay retroactively from the time that the department sends out a statement that ABA is covered. The problem with that is that it could take up to 6 months for them to issue that statement. So there's no timeline that's in the settlement agreement of how fast they're going to issue that statement. So if they are going to do retroactive funding, it should be from the time of the grievance. Thank you.
Very good point. That's something we'll follow up on. Absolutely.
Jim Lantry with the DIR Floor Time Coalition of California. I'm also the South County's Autism Task Force co-chair. I'd like to thank you for your leadership on this issue. It's a fantastic thing that we heard this morning at Department of Managed Health Care and the settlement agreement. But I want to talk about semantics for just a second. I mean, we shouldn't have to be here. This question was asked and answered 12 years ago when this legislature adopted the Mental Health Parity Act. It's pretty clear that that autism was covered. And the only question is, what is the semantics to define what autism treatment is? The problem is that that was not clearly answered at that time. And now today, as I look at it, and I can follow up on what Ms. Lapin said, we're looking at another semantic problem. We're looking at, when we talk about behavioral intervention therapy, we use the word ABA. ABA is a behavioral intervention therapy. It is by far from the only ABA behavioral intervention therapy. And if we continue to say ABA and we use it like we use Kleenex to describe tissues, it becomes so synonymous that when you write the regulations, these other evidence-based treatments become excluded. I don't think that was the intent. We can listen to the testimony this morning from the first panel that talked about how it is very important that these treatments be tailored, and it's important that the semantics be corrected, that we're talking about behavioral intervention therapy, not simply ABA, although ABA is a very strong, important part and very necessary.
Well, that's something that I haven't looked at the language, but I assume it says evidence-based behavioral therapy, not ABA specifically in the settlement. I hope so.
Well, I don't know. I can only say what they testified today.
We'll check it out. Thank you.
Good afternoon. My name is Guillermo Arce. I am the father of Andrew Arce. When people speaks about what's going on in court, it's all about my little Andy. We went all the way up to the California Supreme Court trying to uphold our right to have a class action lawsuit specifically against Kaiser Permanente. My son was, when I noticed that he was sick, he was about 13 months old. Kaiser delayed his diagnosis and treatment for 14 months. Kaiser got fined for $75,000 by the DMHAC. After that, they refused to provide him treatment. He had been receiving that treatment from Kaiser for the last 3 years. From a child that didn't want to hug anybody, he now hugs and kisses, so that's very important to me. There's a lot of things being said, like the other gentleman that was here is we shouldn't be here. And one of the things that when I started the whole thing way back then in 2008 was I smell a rat. And again, I caution the legislature that before you enter into any kind of settlement, make sure you smell that rat. Because that's how the whole thing started way back in 2008. So I just wanted to make sure that, that there is some kind of cohesive coverage issues addressed. And that's pretty much it.
Another way of saying it is the legislature will maintain a vigorous oversight role to make sure any settlements or laws are for the people.
Because you know what? I smell a rat.
Well, there may not be one, but we will. And it sounds to me like a real advance.
Yes.
But
yes, indeed.
But we will look at it very carefully and improve upon it
Okay, thank you.
Go ahead.
Hi, my name is Karen Fessel. I'm a parent of a 16-year-old with Asperger's, and I founded a nonprofit called the Autism Health Insurance Project, and I help families advocate for insurance coverage. They have coverage. I help them get interventions. One of the things that I did was I asked the Department of Managed Health Care for, they made me go through a public records request, and I wanted to know how many families requesting ABA that were sent through standard review, that they weren't IMRs, they were deemed legal coverage issues. How many of the families weren't properly filling out these questionnaires that they were requiring? And they have this questionnaire that they're requiring, and it basically requires a licensed provider to say that the child needs care to be delivered by a licensed provider due to the severity of the case. And I'm wondering if is that going to still be required? Are they still going to make families go through that? For families in certain HMOs, they have to pay out of pocket. They won't get anyone in the HMO to write the letter, to basically fill out the questionnaire. And then also, I have some data from the public records request, which was that last year, ABA, there were, 51 cases of ABA disputes processed as standard complaints. The department determined that ABA services were covered in 51 cases and not covered in 6 cases. The department closed 16 ABA disputes processed as standard complaints because it did not receive the required information. So what that means is that they were not filling out the forms in the way that the licensed providers were not filling out the forms in such a way that they would hear as a standard complaint. And that's a problem.
So these are good questions between our legislative staff and Mr. Devant and others. I think the question of whether or not under the settlement, the HMO will pay for the doctor to fill out the...
No, it's not that. It's that, are they going to continue to require that the doctors fill out this form?
Oh, because it's a requirement itself. Okay.
Yeah, that the DMHC imposed. The CDI does not impose this. It's a questionnaire, making them state that the client needs the care due to the severity of their condition. They need a licensed provider to administer the care.
And that's in the settlement agreement. It's still required.
Oh, okay.
Well,
it was in the settlement.
There was some ambiguity the way it was described, and that needs to be understood, I think, better before we reach a conclusion. Okay? Thank you.
Okay. Thank you.
Okay. I'm Sally Bramell. I'm the mother of 10-year-old Jonah Fox, severely affected by autism. We're constituents of Senator Leno, walking around the Castro with our child every day. My child's case typifies every issue that's come up here. We have a PPO. I'm myself a recovering lawyer. I made it my business that when the regional center recommended that I put my child in a residential placement because he was a danger to himself with running into traffic, a danger to his sister, I'm going to get this through my PPO. 1 year later, it took 1 year. We got a coverage denial. Well, we got a denial that it was educational. We appealed that. We went to the DMHC on the coverage issue. We had to get our doctor, and I had to, line by line, tell him how to fill out that questionnaire with help from others who had been through it that said you have to say it has to be a licensed provider. My BCBA had to go out and hire a licensed provider to provide Jonah's care, although BCBAs are, as you know, trained to do this intervention. That's the intervention he needed.
BCBA?
Board Certified Behavior Analyst.
Okay.
She went out and hired an LMFT to provide Jonah's care.
LMFT?
Licensed Marriage and Family Therapist. And then that licensed marriage and family therapist has honestly got to be supervised by the BCBA, because although she does have some autism experience, the BCBAs are those who know how to deal with the behaviors of my child running into the street to go play basketball. It's a farce. The whole licensing requirement is a farce, but we got through that farce. You know, we hired the person, the BCBA helped supervise that person. My child had surmounted that hurdle, and we got a coverage decision from the DMHC. When I got the coverage decision, I raised the issue with DMHC. I'm now concerned, we're going on months now of my child, of our having to go out of pocket to try to cover my child. I'm worried they're going to say it's not medically necessary. Oh, that never happens. Mr. Bakke said, I'm not aware of that happening. I don't know. I can tell you it happens. they got the coverage decision. I called Anthem. I was elated. I was like, 20 hours a week, Jonah needs this. They said, well, we'll get back to you. 2 weeks later, it's not medically necessary. Your child is 8, and oops, the literature says ABA doesn't work after 7. This is not what the literature says, I can assure you. And your child has epilepsy, and he can't benefit from the treatment. So we went through IMR. So I had initially filed with Blue Cross in July. It was February when we finally got this sent to IMR. In May, we got a decision from IMR that, yes, it was medically necessary. Yes, the literature was out there. This will help older children. This helps children regardless of their cognitive status. In May, we get that decision. I get a useless authorization that says, you have chosen to go out of network. You will be responsible for all charges above reasonable and customary. So I call and say, well, what is reasonable and customary? This is thousands of dollars, and you're requiring that it be done by a licensed provider, not supervised by, but done by. So you're talking about hundreds of dollars per hour, for many hours. I can't do this without you're treating this as an in-network provider. Sorry, we don't have any in-network providers. And I'm a lucky person. I found a provider who could do it. If you don't have the resources, if you don't speak English, if you don't understand the difference between licensed and unlicensed, you're not even going to get to finding yourself that licensed provider. It is just empty to say that you can have this therapy if you find a licensed provider, and if you are, informed enough to tell your pediatrician how to write it to say that you have to have a licensed provider doing it. We finally got it, but we got it because I have those resources, and it took a year to get it. I can tell you that, 1 solid year.
Okay.
And can I say, another thing that has to be fixed is the specious and bad faith medical necessity denials that go on. So they were told, your child has epilepsy. That doesn't negate his ability to learn. He has cognitive issues. He can still learn. Our authorization expired. We got a medical necessity denial. Your child can't learn. He has anoxic brain damage and severe dementia. I call up and I say, where did you find these medical records? There are no medical records that say that. Our apologies. I still have to go through IMR. Enforcement actions need to be taken when medical necessity denials are made speciously. Networks have to be built. I shouldn't have to go out and define my network.
Correct.
I mean, this is what the settlement agreement doesn't address that. It doesn't require the plans to build networks. They need to build networks, and those networks need to be experienced providers and available.
It's hard to cut somebody off, who has such a compelling story, and they're also compelling. But, I think the point is that as we evaluate this settlement, as we look at the legislation, my 166, it needs to be analyzed through this frame, right? It needs to be analyzed through this frame and this story and the similar stories that we've heard to see whether or not good faith efforts and good faith work are actually making it better than what we just heard. Okay, let's go through the last 4 witnesses briefly, please.
Okay, I'll make it quick.
Please.
My name is Tara Delaney. I'm an occupational therapist. I come here as a representative of the California Occupational Therapy Association, who represents more than 14,000 practitioners in the state of California. I also am executive director of Baby Steps Therapy. We provide occupational therapy, speech therapy, psychological services to children in Northern California. We're a not-for-profit agency, and I just want to sort of reiterate what we've heard today. We take insurance, and we are a not-for-profit because we take insurance. And I take $1 every 2 weeks off that clinic because we have to have so much expertise dedicated to fighting insurance companies. If you even mention autism, you can assure a denial. Our therapists, who are speech pathologists, psychologists, and occupational therapists, all licensed. So I want to reiterate that, licensed, and we're getting denied. We are trained in behavioral methods such as discrete trial, pivotal response training, and now one of the best documented methods, the Denver Early Start model right here at the Mind Institute, which is a combination of floor time and pivotal response or discrete trial training. We don't mention autism. We don't mention behavior. We have to make it medically relevant, but even then we are denied, and we fight for families. It has to stop. I understand overseeing when you're handing out money, but we can't have it where medical providers are going under. We have Kaiser right here. Kaiser tells families, sorry, we don't have those providers. You can't get the services. Families have to come to us and pay cash. We collect monies to give scholarships to families. So anyway,
provider networks, easily accessible provider networks.
For speech and OT as well.
Speech and OT as well.
And that's it.
Speech and OT as well.
Happens to be a great segue. Thank you. I'm Gina Green. I'm a California resident and voter, autism researcher, and practitioner, and I'm also the executive director of the Association of Professional Behavior Analysts, which is a national professional organization, international really. And I just want to pick up on some points that were made about providers. Both I'm hearing people say, well, it's got to be catch as catch can for consumers to find people who are qualified to provide ABA services. And then I'm hearing on the other side now, those providers have to be supervised by someone who holds a license. I've worked on the autism insurance mandates in most of the states. They have those mandates. And I will reinforce what Laura Unum said earlier. In most of those states, health plans are accepting the board-certified behavior analyst credential in lieu of licensure. The reason for that is that credential, which is issued by an accredited national credentialing body, reflects the requirements that our profession have identified, the training that's necessary to practice applied behavior analysis. This has been developed over the course of 10 years. The credentialing program is accredited by the National Commission on Certifying Agencies of the something for credentialing excellence. I always forget all of the agencies. This is a valid, respected, accepted credential. The issue that Mr. Flanagan raised and this woman has raised about having people who have licenses in something else oversee the practice of ABA is problematic, obviously, for our practitioners. It's going to be problematic for consumers as well. There will be the problem of people who have a license in something else. Behavior analysis is a distinct discipline. It's not marriage and family therapy. It's not clinical psychology. It's not developmental psychology. It's a distinct discipline. If you have people who have a license in some other discipline trying to oversee a treatment in which they're not trained and qualified, I shouldn't have to explain why that's problematic. The other thing is that it will actually decrease consumers' access to these services, and it will drive the costs up even more if they have to go find somebody who's licensed, absent licensure for behavior analysts, for people who actually are qualified in behavior analysis.
We're hearing it all. I mean, there's access on paper and there's access in reality, and we have to focus on both.
Hi, really quickly, I'm Dr. Linda Copeland. I'm a board-certified developmental pediatrician. I'm also a board-certified behavior analyst. I'm a BCBA, and I want to verify that the process of becoming a board-certified behavior analyst is a very rigorous scientific professional process, and I totally want to endorse Dr. Gina Green's comments and your comments. One other issue, and I'm speaking as an individual physician, that I've been licensed as a physician for 32 years, is that there's a paucity of training in medical education about behavior analysis as a science, and that should be addressed, I think, by separate legislation, especially if doctors within health plans are going to be making issues of medical necessity on a distinctive discipline that they have no training in. I'm one of those rare cross-trained individuals. Thank you.
It's nice to see you again.
Nice to see you.
Me too. Last but not least.
Good afternoon. My name is Brianna Lehrman-Hinsey. I'm here on behalf of the California Association for Behavior Analysis. That is, as the name would indicate, the provider pool of behavior analysts. This is your provider pool. We are happy to be here, and we are engaged, and we are available to you and your staff as a resource. I think clearly we're there's momentum building in getting coverage for autism, whether it's by as a function of state legislation or, as Ms. Unum said, the fairly clear mandate of the essential health benefits package. We are going there, and we as your California provider pool are here for you and want to work together. I want to make two other points. Licensure. It is obviously a hot topic, and clearly there's debate. There have been court cases that have ruled that licensure is not required to be for it to be a covered benefit and for the provider to be paid for the services. We agree with that, of course. That being said, we were the sponsors of a licensure bill just this year. It stalled in the House of Origin. We sponsored that bill because of this hurdle that is constantly being raised for services being available to the children and to the parents.
Whose bill? Go ahead, I'm sorry. Yeah, well, whose bill was it that got stalled? Bill Berry.
AB 1205.
Okay, so that's one we're going to look at.
So that's the status of the licensure bill. I want to also correct something about the status of providers in regional centers. Regional centers do not require licensure. They require certification. So BCBA, correct? A BCBA can provide the services through a regional center. I just want to clarify that currently in this state that BCBAs are able to provide services through the regional centers. They do not have to be licensed.
That's a certification.
Or supervised by license.
Supervised by.
There's an independent vendor category for board-certified behavior
Okay.
with EDS regs.
Right.
You know, this hearing, which really started out as a hearing on coverage versus medical necessity, has evolved into that, plus this issue of licensure and certification, and really about access to providers is really what it is. So we thank you. We thank you very much.
May I make one final comment on the settlement agreement?
Yes.
You're looking for reactions. The initial reaction, is it progress? Initial reaction is no. The key in there is that the providers have to be licensed. You see the circles we're going in.
And you have to find your network provider.
Right. We would argue that your most qualified providers of these services are behavior analysts. They are not licensed. So the catch there is that the parents have to find a licensed provider. Those providers aren't licensed.
We've got to conclude. Thank you. Thank you very, very much. We appreciate it. Hold on. We're not concluded because Senator Dutton and Senator Leno may have some closing remarks. Or not.
No, I found this very informative, and I think you're right. I think there's some other issues that have kind of come out of all this. I would also like to suggest that we come back. We're going to be going, there'll be a brief break we'll have. And certainly, I would think in 30 days from now or whatever, we might want to come back together to see if there's been any new information before we finish the legislative year. And that would be my only suggestion. I'll leave that up to your judgment, Mr.
Thank you.
Chairman.
We'll work together and figure out the best time. Senator Leno?
Thank you, Senator Steinberg, and all of the professionals, families, advocates who have been a part of this process. I think we're making significant progress on the broad scope of that which was agendized today. As I mentioned earlier, through the San Francisco Marin Task Force, we're going to hold hearings, and I hope that I can further engage folks, that we can further engage folks in looking at preventing future generations from having to deal with all that we are dealing with currently, and that would be looking further at the environmental potential factors that causing this explosion of new cases. And asking the question rhetorically right now, when do we focus more on a precautionary principle? Is it when it's 1 in 80, 1 in 50, 1 in 125? If there are alternatives to chemicals that are currently used in consumer products, shouldn't we be allowing for those alternatives to be accessible to consumers? Because something's going on here. We don't know what it is yet. We've got all of these issues. If we can potentially save future generations from having to deal with this, we're making further progress.
Thank you, senators and all the senators who attended, the staff, of course, and the panels and all the people who came here, the advocates, on behalf of your own children and California's children here. You know, there are so many challenges here, but one of them, of course, is that we're trying to make up for lost time. And so moving quickly is imperative. And yet, what we heard today is that we are, in fact, making some progress. My bill, for example, I don't believe my bill deals with the issue of licensure. It deals with the issue of behavioral therapy, intensive behavioral therapy being a covered benefit. Well, just maybe, after we review this settlement here, there's some advance on that end. But there needs to be greater advances here, whether it's the bill so that it's a uniform state law, but as importantly, we talk a lot about the healthcare workforce in this legislature, and we have challenges and shortages across the board, and we cannot unduly restrict access by limiting who can provide the service. And we will tackle that, and we'll tackle it right away. I thank you all. The committee will stand in adjournment.